Pain Relief 101, Choosing Between Aspirin and Ibuprofen. Despite their benefits, both medications have side effects to consider. Aspirin can cause stomach irritation and an increased risk of bleeding. It is not recommended for children under 16 because of a rare but serious condition called Reye's syndrome. The disease causes swelling in the brain and liver. Ibuprofen is usually gentler on the stomach but can still make some people feel uncomfortable. In spite of this, it is safe for children over 6 months old, making it a more flexible choice for younger patients. When you decide which drug to use, it's important to consider personal health conditions and how the medicine may interact with other medications. For example, aspirin should be avoided by those with bleeding problems or who are already taking blood thinners. A blood thinner is a medicine that helps prevent blood clots by making the blood flow more easily. Similarly, people with kidney disease need to be careful when using ibuprofen. Ibuprofen can harm the kidneys by reducing blood flow to them, making it harder for them to work properly. In summary, aspirin and ibuprofen are effective in reducing pain, but their unique properties make them better suited for different purposes. Remember, always consult a doctor to determine the best medication for your needs.
Hello, everyone. Welcome to English for You. I'm Mike.
I'm Nikki.
And today we are back with our Day 2, the article all about Pain Relief 101.
So the things we need to learn to know about painkillers,
Exactly,
right?
yeah. Relieving pain or pain relief, also painkillers, as Nikki explained there. When we say 101, that's actually from sort of university classes. This is the basic information you need. If you're taking a class called History 101, it might be the basic information about world history or something like that. So basically, this is the most important but the simplest stuff you need to know. In this case, when you're choosing between aspirin and ibuprofen, two of the most common painkillers that you can buy in any store. You don't need to visit a doctor and get a note or a prescription. You can walk into a Watson's or a pharmacy or drugstore and buy these on your own. And as we learned yesterday, they work in different ways, and they're kind of good for different things. Aspirin, we learned, was good for long-term pain.
Yeah, while ibuprofen is for short-term.
It's for short-term. Aspirin works by sort of knocking out the pain-causing enzymes in your body, changing them on a chemical level, whereas ibuprofen just sort of blocks them. It sort of stops them from getting through and stops you from feeling pain. So they do work in different ways. But people often don't realize that. So that's why it's really good that we're spending some time learning about this stuff today and yesterday. So let's keep going. Let's get into our article and see what else we have to learn about choosing between aspirin and ibuprofen. All right, let's look at it. It says, despite their benefits, we've talked about the benefits, the good things that they give us or do for us, like stopping pain. So despite their benefits, both medications have side effects to consider. Yes, indeed. A medication is like a medicine, okay? It's a chemical, it's a drug. We take it in our body when we're sick, and hopefully it will make us better or help us feel better. But side effects are things that the drug will cause, changes the drugs will cause in your body, but not the ones you're planning on, okay? So for example, if you take a painkiller, it might stop you from feeling pain, but it also might make you feel sleepy, or give you an upset stomach or something like that. When they test these drugs, they test to make sure the side effects aren't too bad. Of course, if they are, they won't sell the drug. But almost every drug comes with side effects, right? Everything that you take or put in your body has other effects apart from the ones you want. It says aspirin can cause stomach irritation, and an increased risk of bleeding.
Whoa.
Okay, so it will stop your pain for sure.
But you're going to stop bleeding.
But it might cause you to have an upset stomach irritation, like a stomach ache, or an increased risk of bleeding. It doesn't mean the blood will just start jumping out of your body. It means that if you cut yourself, your blood won't stop naturally as quickly. And for some people who take things called blood thinners because they don't want their blood to sort of stop or clot or clog, it can be a problem because now you'll bleed even more. And that's what bleeding is. Bleeding is the process of losing blood from the body. But if, of course, you get hit on the nose or you cut yourself or, an accident or something like that, bleeding, of course, will be something you'll expect to happen. So bleeding is okay as long as it's under control and you know why you're bleeding. But bleeding too much can, of course, be bad for you because, blood keeps you alive. For example, if there's bleeding from your nose, don't tilt your head back.Just pinch your nose.
那接续前一天我们提到2种不同止痛药的功效，今天要聊聊它们分别有什么副作用。其中阿司匹林的副作用就是可能会造成一些肠胃的不适，甚至呢还有会有出血的风险。这边看到 bleeding 这个名词指的是出血或者是流血的 condition of losing blood。那另外看到 irritation 这个名词指的是因刺激产生的疼痛 a painful feeling. It can also be something that makes you feel annoyed. 可能是一个恼人的事。那本句呢也包含了今天的 language and focus. Let's take a look. 那今天要比较 medicine 和 medication 的差别。medicine 和 medication 都可以用来表达药物的意思，但是 medicine 呢通常指的是治疗疾病的物质或者是治疗过程，它可以是药物也可以是医学领域本身。So for example, my dad studied medicine for years and went to medical school. 这边指的就是医学领域。那如果我们要用药物的话，我们可以说 You should take some medicine if you're still feeling sick.那 medication 更常是用来指一个治疗疾病的药物，特别是处方药或者是治疗特定病症的药物。那通常指的是你需要服用的药物。So for example, the doctor prescribed strong medication to help her recover from the infection.
All right, back to our article. That's what we're talking about here, of course, is aspirin. It is not recommended for children under 16 because of a rare but serious condition called Ray's syndrome, a disease, something that can happen, especially to young kids. I do know they sell something called baby aspirin.
Oh.
So maybe that's the safe one, and they they change some of the chemicals in it, or maybe that's something that they don't sell anymore. So that is interesting if you're giving a painkiller to a young kid, and young kids, they might have accidents, of course, or they might have a fever.
因为它有可能会造成雷氏症候群，它是一种好发在儿童身上的疾病。所以16岁以下的儿童呢是不建议使用的。那 recommend 这个动词指的是推荐或者是建议 advise somebody to do something。另外最后看到 syndrome 这个名词指的是症候群 an illness that consists many types of qualities。像是雷氏症候群这边它指的就是它的症状呢有很多，那有些人会呕吐，有些人可能会昏迷，那很多种不同的症状我们就称之为 syndrome 症候群。
It says the disease causes swelling in the brain and liver. Okay, that's not good. Ibuprofen, the other one we're talking about, ibuprofen is usually gentler on the stomach, but can still make some people feel uncomfortable. But perhaps the feeling of being uncomfortable would be worse if you're taking aspirin. And certainly swelling of the brain and liver, that's something you want to avoid. Swelling is when something gets larger. In the body, it's because it often fills with blood. If you've ever fallen down or twisted your ankle or sprained your wrist or something, and then a few hours later you notice that the skin, the whole part of your body seems much fatter, like it's being blown up like a balloon, that is swelling. In the same way that when you bump your head, and then 20 minutes later you might touch the part where you hit it, it hurts and you feel a bump there, right? That's swelling. That's blood rushing to the area to try to treat it and heal it and make it better. But at the time, it's fat, it's swollen, which is the adjective of swelling, and it's painful to the touch. But that is a sign that your body is taking care of the business. For example, you could really see the swelling of Marty's ankle the day after he injured it. Yeah, it can really blow up to twice its normal size.
那 swelling 这个名词指的是肿胀。So for example, if you ever get touched by a jellyfish, it can cause pain and swelling. 所以说呢，阿司匹林的药效会强一点，那也比较有风险。布洛芬的效果呢就会比较轻微，但是还是会有一些副作用。
Okay, well, Ray's syndrome, which causes swelling of the brain and liver, is definitely something we want to avoid. Ibuprofen is gentler on the stomach, so it might be easier on your stomach, give you fewer stomach aches or something like this. So that's generally or basically the best one for kids. As it says, in spite of this, in spite of the stomach problems you might feel when you take ibuprofen, ibuprofen is safe for children over 6 months old making it a more flexible choice for younger patients.
那也就是说，如果是比较小的小孩，就会比较适合用 ibuprofen， 因为它是只要6个月以上的小孩就可以使用。那 flexible 这个形容词指的是可变通的或者是灵活的 able to change or be changed easily according to the situation. So for example, my schedule is flexible, I'm always available. 指的就是我的时间很好瞧。
Here's good advice too, not just for painkillers, but for anything you might you might put in your body when you're not feeling well. When you decide which drug to use, it's important to consider personal health conditions and how the medicine may interact with other medications. You know, there's these people that work in hospitals. They often wear long white coats. They're called doctors. They know all about this stuff. We don't, but we have to kind of think like a doctor, or if we don't know the answer, go and talk to a doctor, because it's important, as it says, no matter which drug you take or any drug that you take, it's important to consider personal health conditions. Young people, old people, big people, small people, they'll all have differences in their bodies, right? That men and women as well, that are definitely worth thinking about. No drug is the same for every single person.
Exactly.
Not at all. That's not how it works. So we have to know about your personal health conditions. Are you a healthy person? Are you not? Are you fighting other diseases at the same time? And that affects how the medicine may interact with other medications. I think they often do this on the computer in the hospital, right? But if you're buying it for yourself, you need to know if I'm taking a medicine, I don't know, because I'm trying to have a baby or something like that, can I take these other medicines? What will happen? I heard somewhere that if you're taking medicine, don't drink tea, because there's something in tea that can stop the medicine from working really well.
And milk as well, I've heard.
Milk too. Sometimes they tell you, don't take it with milk. And, you know, sometimes we don't know those things. So it is very important to know what you're taking. And if you don't know, ask. And often in the pharmacy, the person who works there, they know a lot about these medicines. You can ask them too. You don't always have to go to a doctor, because how they interact can be very different depending on what other medicines you are taking. So if something interacts, it means they have an effect on each other, basically. There's some kind of thing that's going on there, and it won't just these two medicines won't just sort of ignore each other. They'll cause a change in each other. In the same way that if you put some minty candies into a bottle of Coke, it might suddenly blow up. It might shoot out the top, right? Because there's something in the minty candies and in the sugary Coke that's causing some kind of change. They're interacting in a very interesting and explosive way. For example, the new medicine may interact with certain foods, so read the instructions carefully.
那同时也要注意，在选择药物的时候呢，要看看它们和其他药物的相互作用。这边看到了 interact 这个动词指的是相互影响或者是相互作用，那它的名词呢就会是 interaction.
All right, for example, and here's a very important but very good example. For example, aspirin should be avoided by those with bleeding problems or who are already taking blood thinners. We mentioned this in day 1 of the article. What is a blood thinner? A blood thinner is a medicine, another medicine that only certain people would take. This kind of medicine you would get from a doctor. But a blood thinner is a medicine that helps prevent blood clots by making the blood flow more easily. You might be born with this, or as you get older, it might affect you. Blood clots can lodge in your different parts of your body. And if a blood clot goes into your heart or your lungs, it could actually kill you. It could actually be very dangerous. But generally, people who have this problem, they'll know. They'll be on these blood thinners. But they should be careful when taking aspirin, because they can interact badly, these two kinds of drugs.
那举例来说呢，如果你是已经有出血问题的人，或者是正在服用抗凝血剂的人，就应该要避免使用阿司匹林。那抗凝血剂就是一种通过让血液流动更流畅来帮助防止血栓形成的药物。那另外 clot 这个名词指的是血或者是其他液体的凝块。
All right, next it says similarly, so in the same kind of way, a bad interaction we're talking about here. So similarly, people with kidney disease need to be careful when using ibuprofen. So ibuprofen might be safer in some ways, but for people with kidney problems, it could be the wrong choice. Why? Ibuprofen can harm the kidneys by reducing blood flow to them, making it harder for them to work properly. This will be people who already have problems with their kidneys. Their kidneys are already damaged or weak. If you're healthy, take some ibuprofen for a few days. That's fine. Maybe drink a bit of extra water, clean your kidneys out. it's not so bad. But if your kidneys are already having problems, ibuprofen can reduce blood flow to the kidneys, making it harder for them to work properly. And kidneys are some of those really important organs in our bodies. We have two kidneys. They're kind of more towards your back. They're shaped like the beans. We call those kidney beans, actually, because it's kind of the shape of a kidney. And they basically help to clean your pee. A lot of the stuff that you have in your body that's not good for you, like poisons and toxins, it comes out in your pee, and your kidneys are kind of in charge of that. You can live with one. You can donate one if, your brother or sister has kidney disease. You can give them one. Or if you're at the hospital and you're going to see a nephrologist, that is a kidney expert, so they can help you out. Luckily, most people will have relatively few problems with their kidneys, maybe until they get older, but they are important and we need to take care of them. For example, as they get older, many cats suffer from problems with their kidneys. Yeah, it's usually heart disease that gets us humans, but with cats, kidney problems can be very serious.
那对于那些有肾脏疾病的人就要小心使用布洛芬了，因为布洛芬呢会损害肾脏，那让肾脏就更难正常的运作。Kidney 这个名字指的就是刚刚提到的肾脏 an organ in your back that is in charge of waste products, urine or pee, as we said.
Indeed. So let's wrap everything up as we get towards the end here. In summary, aspirin and ibuprofen are effective in reducing pain, but their unique properties make them better suited for different purposes. Very true.
那 in summary 指的就是总之呢，就是说总之呢，这两种药都对消除疼痛很有效，但是它们的特性不同，所以也会因此适合不同的目的。
Remember, always consult a doctor to determine the best medication for your needs. I don't want any of that. I did my research on the internet. You're not a doctor. You should talk to a doctor or at least the pharmacist, the person at the drugstore. They know a lot about these medicines.
Exactly.
So talk to an expert or consult a doctor to determine which medicine is best for you.
Oftentimes when you Google, it tells you have cancer.
Yeah, exactly. Don't look up your diseases on Google unless you know exactly what you have, because you're right. You'll get scary news or bad news. Plus, if you go to the doctor's office and say, well, on Google it said this, the doctor is going to go, oh.
Again, another one.
Another expert. I did 10 years of medical school. You did a 10-minute search on Google. You must know more than me, is what the doctor is thinking. As you consult with them, they are scientists, they are experts, they know the stuff. So let them make decisions for you, or at least give you good advice. To consult is to talk to someone for information, for advice. They're an expert, they know about it. Maybe they're just very experienced as you. Maybe it is their job. But if you don't know much about something, go and consult with an expert, because they will know and help you, know a lot more than you and help you. For example, I think we should consult with a lawyer before we decide to open a business. A good idea. And we also had the word to determine. This is a verb, and it's basically to control or influence directly. It's kind of also like to decide. For example, we could say a simple coin toss determined which player went first. That's how we decided or controlled who would start the game.
那 consult 这个动词指的是向某个人或者是某个东西、某个地方咨询或者是请教。那最后看到 determine 这个动词指的是决定或者是确定 to officially decide something。所以呢，要记得在服用任何药物之前都要先咨询过医生，再来决定最哪一种最适合自己。那喜欢今天的节目吗？快按赞追踪我们的 YouTube 频道和 Facebook， 不要忘记开启小铃铛，掌握第一手英文学习内容。
All right, we have our chat question here. Have you ever experienced side effects from a medication? And please tell us about it.
I would say I have. When I take my pills for my allergies, I would often feel very sleepy.
Oh, that's a very common side effect, right?
Yeah.
Many different medicines will say if you take this, don't drive a car.
Exactly.
Things like that. Yeah, that's definitely a common one, but also a possibly dangerous one. So it is a good idea, even if you buy the medicine, even if it's something simple like a painkiller, read the instructions, read the box, get as much information. It is your body, so you need to make the right decisions. Take care, everyone. Take care of yourselves, each other, and your kidneys. And we'll see you back here soon. Bye-bye.
Bye.
Vocabulary Review.
Bleeding. Mia saw bleeding on her friend's arm and quickly gave her a tissue to clean it. Swelling. I hurt my ankle pretty badly. I need to wait for the swelling to go down before I can walk again. Interact. The warm air interacted with the cold ocean water, which led to the thick fog. Kidney. Eating too much salt can be bad for your kidneys because it makes them work harder. Consult. If you are unsure about the contract, you should consult a lawyer before signing it. Determine. Many people believe that success is not determined by money, but by what you do in life.
智慧小补帖
Irritation. Recommend. Syndrome. Flexible. Clot.